So on the message that I got from one of my followers on Facebook, so this lighting, this is like the worst lighting ever here, but whatever. They were asking about amino acids, probiotics, and endocannabinoids in the context of autism, and I missed that part. I skipped that part ahead and just jumped into the supplements or the treatment strategies. So autism, I have no experience treating autism. I've helped one person out with some autism. They were actually developmentally delayed. They had some serious problems when they were like little baby, but as a 20, I think they were anywhere from 20 to 25 years old at this point, and they had basically severe developmental issues. And I used homeopathy, and it was quite successful to a certain point, but I didn't work with him long enough. I didn't feel I was the right match to help him out. But homeopathy, without a doubt, is the number one thing. But what they find with autism is, of course, you have a leaky gut, you have a systemic infection going on that is probably in a form that's not so obvious to treat, and like a latent miasmatic or active miasmatic state. Basically what that means is it's an infection that is there, but it's in a form that the immune system is having a real serious time grappling with and dealing with. It's kind of in a latent state, and it's doing its damage. And then you also have heavy metal poisoning throughout the system, probably in the brain. So that's the situation. So they need to get on to the best protocols are this: homeopathy, allergy elimination kind of thing. Amino acids work really great because their digestive system is damaged. So allergy elimination, really great digestive protocols, and homeopathy, of course. Find a really good homeopath. There's a lot of bullshit homeopathy out there. Find a really good homeopath, and there's a whole set of remedies that are famous for autistic kind of displays or expressions. And of course, you have hair mineral analysis and traits, basically balancing out the system using hair mineral analysis. If you want to understand that a little bit more, the work of Wilson, Lawrence Wilson, he writes about this he's a doctor, but he's not licensed anymore, or if he ever was, I'm not even sure, but he writes about this area, and he's got lots of things he's talked about on the internet regarding this area. So those are your best strategies to really deal with the condition. You can really get someone up into a very high level of function if you just do those things. There is a person inside there. They are not, even though they act like they're out of control or kind of wacky or whatever, you're probably dealing with someone in your family like this. But there's a person inside there, and they're very sensitive, and they're experiencing life in many ways just like you, but their expression and input is really severely skewed and distorted. So that's about it. That's my experience with it. With dealing with that sort of thing. That's how I would approach it. So good luck. If you have any questions, please post again, and I'd love to give you some feedback. Thank you. Take care.